Attaches an overview of my client. So my client, her name is Renee. She's a 24-year-old African American, and she's currently experiencing suicide ideation. So she's experiencing a feeling of hopelessness, disconnected from the people close in her life. She has expressed that she finds it very hard to keep going. Her thoughts have been weighing her down and making life difficult. She just wants help with coping with life and how to manage suicidal thoughts and fight to keep going. Attached, you will find my YouTube video link with the full role play of Group 10, which included LaShonda. In this video, the therapeutic approach I used was CTSP, also known as Cognitive Therapy for Suicide Patients. So what CTSP does is it helps patients develop better coping skills by restructuring their thinking and behavioral patterns. I also use a combination of that in existential therapy. And existential therapy focuses on exploring fundamental questions of human existence, such as meaning and purpose in life, isolation and connection, and death and mortality. There are several therapeutic approaches that I use to counsel my clients. And one of the, or a few of the skills and techniques I used was CTSP and SFT, which is a cognitive therapy for suicidal patients. And then I offered solutions, so some solution-based techniques as well. And at 618, I did some cognitive restructuring for the client, asked them an open-ended question that allowed them to think about the situation, and then gave them more of a hope in that situation. Then I used guided discovery at 232 and 518. More open-ended questions, but kind of guided them and helped allow them to just self-reflect and discover the things that are going on in their life. We did a lot of goal setting in this video because with CTSP, there are a lot of goal settings that happen. So at 5:30, 7:03, 11:09, and 13:30, we did some goal setting. And then most important thing when you're using CTSP is creating a safety plan. Not saying that the client will commit suicide, but just having a safety plan in place for the client in case they are having those suicidal thoughts. And that safety plan involves them coming up with a list of emergency contacts or people that they can call if they are feeling overwhelmed or suicidal. I offered the client a list of people that they can call, which is the crisis hotline, me as a therapist, doctor, a pastor, and of course, I asked the client to come up with a list of people in their family that they trust to call in the case that they are feeling overwhelmed and suicidal. Also, when I was using the cognitive restructuring, I asked the client what they can change about their situation to allow them to kind of reflect about the situation and then understand that their situation is temporary and that they can focus on their goals. So if they know that their situation is temporary, they can focus on their goals for their future. I think given the situation that the cognitive restructuring part is so important so that the client knows that they do have a future for themselves. Other skills we used in this video are existential therapy. So we asked open-ended questions throughout the video. So you can see at 121, 335, 350, 742, 930, and 1051, I asked some more open-ended questions. And then we had an open and honest dialogue for about a minute at 8:05 through 9:06. And then again, another open-ended dialogue at 10:10. There was some philosophical questioning that happened at 12:21, paraphrasing at 6:08 and 9:13. And then, of course, I showed some empathy, a lot of empathy actually, given the situation. And empathy was shown at 1:45, 2:10, and 4:30. And then, of course, reflecting is important with a suicidal patient as well. After watching my video, I uncovered a significant amount of areas of opportunity. And as a clinical mental health student and a future therapist, I think that these opportunities are important. And one of the things I found myself doing in the video is checking off bullet points because I wanted to ensure that I covered all of the therapeutic approaches that I learned in the class that related to this client. And so I was just being really cognitive about, did I check this off and should I check that off? Instead of really taking the time to understand the client and have more of a flow. And so as I continue on this career path, I do want to work on that better, my flow better, and being more engaged with the client. Here's a list of some of my takeaways. I should allow the client to engage more. As a therapist, I should have talked less and listened more. I should have used more use of silence, more reflecting, and more paraphrasing.